All right, let's get in the mood. Okay, that actually has nothing to do with this post, but I really wanted to get to your attention because basically, there's a fact like this, which is Wendy Williams, who is a very successful woman, was hospitalized. And what you're going to listen to is a phone call of a doctor that takes way too long. But basically, it's about the fact that my mother should be hospitalized. Now, I didn't want to do this post in a certain way. I didn't want to play the whole my mom is smarter than your mom kind of thing. That's my mom. But I do need you to kind of understand when you're approaching this situation that my mother is kind of different than many other moms in the sense of what my mother does for work is she's a CIA certified internal auditor. There's only 160,000 of those in the world. So as you can see, there's not that many of them. To pass the test to become one of those, only about 40% of the people that try get it. So that's just some sort of kind of facts about her job and what she does for a living. And the reason I bring that up is to indicate that my mother, it's not possible for her to have certain kind of mentalities or being unable to understand certain things and be able to complete her job. Now, this is just a random text that my mother sent to me back in April. Literally, I don't know she sent it to me out of nowhere, indicating that she went through these books of mine. As you can imagine, my parents have a whole bunch of my old things from my teenage years. I don't know why she grabbed those two things. She went through my baseball card collection, and from what it seems like, she appraised every single one and figured out one of them is worth $1,000. But what's very odd is there's an album right next to it that I wrote, Do Not Touch. More than likely, it just has photos that at the time that I was a teenager, I don't even know what's in that album, but didn't want her to see. And yet she wrote to me that she didn't touch that album, but did read through my high school yearbook notes. And like I said, the reason why I bring that up is just kind of get a state of mind that is not normal. I think almost anybody who is a male, who has a female mother, I think it's everybody, right, could kind of understand. If you have a baseball card collection, it doesn't make sense for your mother to go through them and appraise them this way and then randomly text you. And then, by the way, she refuses to send them to me. But also, this is the doctor. This is a text message from my mother that I received in December, a few months after this phone call. And she mentions a doctor, Dr. Prange, which is the doctor who you will hear this phone call on. And basically the whole deal is that she went to this doctor and said, hey, doctor, my son is alienating himself from me and I would like to talk to him. That's not true. I'm actually trying to talk to my mother. She just seems to have some mental health issues. Doctor calls me. Like I said, it takes way too long of a phone call. But he calls me and I'm like, hey, actually, this is what's going on with my mother. She has these mental health issues and it's really her who needs help. I don't know what to do. He ends up just doing nothing. You'll hear in the phone call, he tells me that he's concerned about my mother. He's going to end up talking to her. Apparently he didn't. My mother is still contacting me, telling me to contact him, or that he believes that I need to go talk to somebody, but he hasn't told her why. And my mother doesn't see anything wrong with all that. So this is actually a really, really big deal. And if possible, kind of scroll. It's on, like I said, it's a very long phone call, but if you could scroll through, and if you could just share this with as many people as you possibly can, and see if we can kind of get this doctor to at least be held accountable. Because right now the situation is as odd as it sounds. My mother truly believes that I don't want to speak to her. And here I am posting on the internet trying to get people to help me communicate with her, or at least get her help, because I very much do want to speak to my mother. It's just that she seems to be having some kind of mental health issues in which she's not able to comprehend that. So anyway, here is the phone call, and that's it. Hi, I need to, I think his name is Mark.
Yes, Dr. Prange, yes, go ahead.
Hey, Mark, I got a call from my mother, Jerry Estrada.
Okay.
I guess she's scheduled or was scheduling an appointment with you.
Okay. Yes.
Oh, okay. So here's the situation I'm dealing with. Couples therapy
Okay.
doesn't seem appropriate, but it seems as
Correct.
if you do, and so initially I kind of need to know why you do.
Well, I mean, this would be more like coaching, family therapy. It's about, finding a way to communicate more effectively with a family member.
No, I understand that, but why do you feel it's appropriate? In other words, what did my mother tell you that is the situation, so we can kind of get started from that?
That there has been a problem with her role as a parent, that she was not as involved, and that there are cascading consequences that resulted from that, and she would like to have a better relationship with you.
Okay, and so that's all she said?
Correct. And
Okay.
that you do have a child, so she has a grandchild, that she would like to be able to be helpful in protecting that grandchild, not from you, but from I guess it's the person that you married who now has majority of the parenting time with your daughter.
Yeah, that's true.
Okay.
It's just
That's
not.
all you're saying.
It's not. Let me put it to you this way right now, Mark. Right now, I have heart failure. One of the issues that I'm dealing with is for the last couple of days, I've had chest pains. One of the reasons I can't speak to my doctor is because my mother, for some reason years ago, was involved in some kind of deal with SF General. They have a medical record that's completely incorrect. My mother knows is incorrect, and yet has not been able to, how do I put it, process correctly the steps involved in fixing that. And that's just one thing. So in other words, my mother is calling you, stating to you, oh, I kind of want to have a better relationship with Charlie, and all these things have happened. But she's not able to process that I have heart failure.
Okay. So what do you think is going on? Why can't she process that?
More than likely, I mean, I can kind of go, I don't want to do kind of armchair psychology, but it seems to me there's obviously, she has some psychological issues with me. My mother, she didn't raise me. I didn't live with my mother until later on in life. And so there's always been issues with that as far as she's concerned. But that's what I mean. Like, that's not something that involves me. That's just her own psychological issues. Like, for kind of put it to you in a different way, is my mother this is the first time she's reaching out to someone in Florida. She has kept reaching out to people in San Francisco who have said to her, it's not appropriate for you to be doing couples therapy for this. These are serious matters, and you need to deal with somebody in Florida. And she hasn't until now. So you're the first person I get to speak to in Florida who's actually a therapist in Florida. Everybody else has just been like, your mother's calling me, but she's in Florida. I've told her to speak to somebody in Florida.
Okay. Okay, so do you think, your mom is competent, right? She can, ultimately...
I don't know. See, this is where it gets really weird, Mark. If I'm telling you my mother can't process things, no, she's not competent. In other words, she is competent, it seems, in other ways. I am not a therapist, but she's not competent enough to understand how idiotic it is for her to be calling you for a situation in which I am dying, literally I am dying, and she's not able to process that.
Oh boy. Okay.
So basically my deal is I don't know what to do, because from my understanding in Florida it's a whole different deal. She's been seeking out therapy, but she's just been doing it basically by lying. and not really addressing the actual things at hand. And so for me, I don't know what to do because I know couples therapy is just not an appropriate place for it. As a matter of fact, one of the reasons we're here is from my past with couples therapy, and understand, and now having a good understanding as to what is done in one of those situations. So without kind of rambling too much, but if you're asking me another reason as to why, it could be even just as simple as that. To kind of summarize it on it, the mother of my child and I went to couples therapy. From that session, from couples therapy, it was recommended that she see a psychiatrist. That psychiatrist ended up giving her a diagnosis from that, and it's
what was that diagnosis?
Dissociative identity disorder.
Okay.
And then from that, it became kind of a mess because she never went to treatment, and then we ended up separating. And I know there's still kind of a whole issue as to, well, what's the deal with that diagnosis, and kind of what happened and whether or not it should be addressed. So it's all kind of a circle. And so when you say something like, well, yeah, my mother's, supposedly she's competent. Like, this is what I don't understand. My mother has to have very technical skills to be able to get through her day and work. But at the same time, I don't know what else to tell you. Like, I have heart failure. That's not a question. There are many other things involved. Like, even when she says my daughter, my mother seems to be convinced that I don't want to see my daughter. That is not true at all. That gets a little bit more complicated, but it is as simple as that. It is not true at all, and my mother's actually done many things that would inhibit that. So she's contradicting herself in ways that the only way that makes sense to me is because of my history of my mother and understanding that my mother has always had some kind of psychological issues with me based around the fact that I didn't grow with her. And there's kind of questions on it too, but I don't really have the answers to it, nor do I really care as much, but I do kind of understand, especially being a parent now, how that would affect her.
Okay. But do you think that her intentions in wanting to be helpful to your daughter, her granddaughter, that those are sincere?
Okay, Mark, this is where it gets really difficult because I don't want to kind of keep repeating myself, especially with a professional. I just said to you that she has done things that are the opposite. They're contradictory. They're not opinion things. They're actual factual things. My mother has actually made it difficult to be able to protect my daughter from her, from anyone, from the mother of her child. She's done contradictory things. Not said contradictory things, done contradictory actions. So they're not sincere in the sense of they have had negative outcomes. Again, the only way that I can make sense of it at all is the fact that my mother is a very smart person, and the only way that I can possibly think of after this amount of time to begin to prove, I guess, foul play by others is to kind of show that another professional wouldn't react that way. Now, again, that's kind of a theory. That has nothing to do with kind of the very basic psychological things that are happening right now, which is my mother is contacting you, believing that, couples therapy would be an appropriate situation for us at this particular point in time when she can't even process some of the most basic things like, I have heart failure. That's actually going on. She's inhibiting my ability to be able to speak with my doctors because she has been involved in my medical care in the past. And so it's without her participation now is basically a he said, she said kind of thing. And it's making it difficult for me to receive health care. Very simple.
Okay. So, to me, you're right. Couples therapy does not make sense. If I can be helpful to you so that she doesn't inhibit your ability to get, medical attention for heart failure, that would be helpful. I don't mind. I mean, give me a list of things I need to do to get her on board with so that she's not interfering.
Yeah, I don't know. See, that's the thing. That's a weird approach to it, because that's not a mental health kind of approach. My physical. That's where it's getting kind of complicated, right? Because for me, when you're asking me a list, it's kind of like, look, I don't know. I do know that I do need to speak to my doctor. I don't know how else to kind of explain that to my mother. So I don't know when you say like, what would you like from me? Like, would you like my medical records? Like, where would you even begin with that specific thing? Like, hey, right now, literally, I have heart failure. I've been having chest pains my last couple of days, and the main reason I can't speak to my doctors is because they have spoken to my mother in the past. My mother has said things that they're just incorrect, they're lies, and the doctors are not accepting my statements that they're lies, and she's not willing or able to understand that she can solve everything simply by talking to them, but hasn't been able to process that.
Okay, so do you have any idea what she said to your doctors about your medical? I mean, first of all, they should be not listening to that. They should be looking at the lab results.
Yes, I understand that, Mark, and that's where I'm at with this. Like, I started recording some of the phone calls to my mother to try to play them back to her. She's refused to listen to them, but I literally have a recording of this particular instance where my mother is saying the exact same thing that you just said. In other words, stating the fact that we all know, and pretty much anybody who's been around in the medical field would know, that the doctors would have no reason, no ethical, medical, there's no reason why they would be listening to my mother, but that's what they're doing. So that's where I'm at with it, where my mother has stated to me, and I have a recorded phone call where she understands exactly what you're saying, yet if I attempt to have this conversation with my mother, and I have, she then doesn't, she's not able to process it. Now, for me, what my problem is, I don't have, and it seems as if you can understand, I don't want to get in a situation in which she further feels justified that there's nothing wrong. Because that is what has continued to been happening. In other words, she has contacted people, like I said, she's contacted therapists in San Francisco. Therapists in San Francisco will say to her, this isn't really appropriate. You should contact somebody in Florida. Now, because there isn't any written or any kind of actual situation in which all three of us are speaking at one time, she'll later on say to me, that's not what the doctor said. And I'll say, well, I have it. Maybe I have an email. Maybe I have a recording. Doesn't matter what I have. She'll just say that's not what actually happened and won't be able to process it. Now, that's a very different situation when it's just a matter of couples. When it's like, oh, I thought this and you thought that. But this is a very real thing. You know what I mean? It's not a couples situation. It's not an opinion. It's real things that have happened that for some reason she's fluctuating on whether or not she understands or accepts that they actually have happened.
Okay, I get that. How long have you known that you've had heart failure?
That's been since last June.
Okay. So it's a little bit of a surprise for her too.
No. This is not a surprise. What again? The only difference, Mark. The only difference is right now is that she's contacted somebody in Florida for help. In other words, this has been going on for quite a while, years, really. Okay. Unfortunately, for way too long. What the only difference is that I don't have the ability to force anybody into treatment the same way of anything else. So she's been playing. I don't want to say she's been playing this game, but it does seem like a game if she is competent or something's going on. But either way, what she's been doing is
denial could be part of this, which is different from her trying to be playing a game. But
exactly,
she's just in denial about something.
Exactly.
Go on.
And so. The only difference of what's happening now, Mark, is that you actually have the ability, because she's in Florida and because she reached out to you, you actually have the ability to be able to do what you're doing right now, which is saying, like, hey, I can see that, I understand that you have heart failure. If I could just do this one thing, then let's do that. To not kind of ramble on, my only issue with that is I don't know where to begin with that, because I have tried to approach that in the past. And as urgent as it is, I don't, that's where I've been stuck on it. Like, it is super urgent, but if she doesn't take it urgently, then I can't do anything about it. I have called in wellness checks in the past, to try to get the police to kind of, specifically about my heart failure. But they don't, they just simply ask whether or not she's going to hurt herself. She says no. At times she has said that. She'll kind of say different things. Sometimes she'll say it's all about money, that I'm only, the only reason I'm contacting them is about money. It has nothing to do with money, but they'll just kind of let that be and not look into anything else.
Okay. So, I mean, overall, what do you think would make the situation better?
Well, Mark, that's what I'm saying. Like, we're going in circles. I don't know, Mark. I am not a mental health professional in that sense. Like, I just explained to you that I was in a relationship with somebody.
I get that part that you've explained to me, but I also feel like you're smart and that you've got ideas, and so you may have.
No, I'm telling you, my mother's smart. My mother has ideas. What I am is just living my life. So when it comes down to this particular situation, I have been informed of certain things by my own mother, which is also what makes it odd. Like, I have been informed of certain things, like, in Florida, if you go to a therapist and say, hey, I want therapy, and then you say I don't want therapy, that becomes a Baker Act situation, at least the way my mother has explained it. My mother has explained it in detail, which is why it's very difficult for me to understand, or why it feels as if my mother was playing games in the past, because, in other words, she was always reaching out to therapists in California to kind of, I don't want to say to do that, but what that did result in was improving a certain point that is relevant in my life, which is in California, apparently, it is different than in Florida, which is in California, even if a doctor, a mental health professional, has given you apparently a diagnosis in which there's concern about your safety or others, the doctor can't do anything, where apparently in other states like Florida or Kansas, where we lived as well, there are these things. Now, for me, I didn't learn those things other than through my mother, who has seemed to, instead of just kind of doing what would be normal of saying, hey, Charlie, I looked these things up, this is kind of what's going on, has seemed to want to do it by, I guess, teaching by doing, I guess. And again, the only difference being that you are actually in Florida, and from my understanding, from the way my mother described it, she also seems to have an understanding that there is a big difference in Florida for somebody acting as delusional the way she has been with me, than if the same actions were happening in another state.
Okay. Do you think that your mom is functioning well enough to be able to have a role with your daughter?
Mark, again, I don't want to repeat myself. When I said she has done actions to inhibit my daughter's safety, that is not an exaggeration. Again, these are all, just to make it clear to you, when I speak, I don't speak about opinion, not to a mental health professional. This is just not necessary. That's a different kind of thing. That would be when we're actually in a couple session kind of different situation than we're at now. The reason I'm speaking to you about facts is because they are facts that are relevant with or without me. In other words, these are questions for her that are psychological, mental health questions for her. In other words, again, what you're stating right now about my daughter is difficult for me to not understand how you can't understand, other than you're just not accepting the reality and the facts that my mother has done repeated actions to inhibit my daughter's safety. Again, this kind of just as simple as this. My mother, as far as many times, as far as I know, no matter what she says at other times, the majority of times that me and my mother have spoken, my mother speaks to me and has written down as well in emails, that she believes that I don't want to be part of my daughter's life. There is nothing true about that, and the facts of that are actually that my mother has made it more difficult for me to be part of my daughter's life. Now, that's where I'm at with it. I don't,
Are you there?
Yes. Sorry, I don't want to keep rambling, and it
It is that simple. It is that simple. My mother has actually made it more difficult for to protect my daughter's safety.
Okay. So I mean, again, I was missing the one piece, which is you're saying it's not just that. I get that she's inhibited or done things directly to prevent you from having contact with your daughter, and that's harmful. But has she done things directly to your daughter herself? I mean, like intervened in ways that harmed your daughter directly?
Well, I mean, again, Mark, one of the ways specifically, and I don't have any of the details because I guess another thing to make clear is that, obviously my mother is not communicating clearly. But at one point in time, she flew out to California, here to California, and showed up at the mother of my child's house, and then got a restraining order issued against her. Now that's multi-layered. When you talk about competent, my mother knows that the best way, if she wanted to see my daughter, would be to do it by the courts, with or without me. It's absolutely ridiculous for my mother to fly out. In other words, a very planned and known and understood kind of action to fly from Florida to California, not contact me, not in any way contact the courts, but think that somehow or another she was going to show up at her house and be able to see her granddaughter. Everybody knows. My mother would have even been, again, this is one of those things where she can argue it one way or the other, but there's actual evidence that she would have known from myself and from lawyers that would not be the appropriate thing to do. That would actually inhibit both her and my ability to see our daughter, for no other reason that's exhibiting her inability to control herself. She, for some reason, again, she lives in California and one day got up and, I don't know, for whatever reason, felt as if my daughter was in danger. This is someone who was in Florida, has access to funds and, the ability to get a lawyer, planned out an entire trip, which really would have been more appropriate to do via the courts, simply because everyone knows the only results that would be from that would be making it seem as if I and my mother are unable to control ourselves. And I had nothing even to do with that entire interaction.
Correct. Okay.
And that's a poor record.
You need to get the correct medical care for whatever heart issues you are having.
I have heart failure.
You make certain that happens for you.
Yeah, I mean I've been trying, Mark, but see again, that's what I'm saying. Like right now, what I don't want to do is keep going over things because not even one thing has been able to be focused on. But if we want to focus on the medical record, again, to go back to the situation is my mother has done similarly. Hello, Mark? Hello? Hello? Hello, Mark? Oh, sorry, Mark. Hold on a second, man.
Call for you to renew the warranty before we close the file. Would you like to hear your...
Shit.
Welcome to Verizon Wireless. Your call cannot be completed as dialed. Please check the number.
Hello, Mark? Yeah, I'm sorry. I it was the same area code, and I thought I had dropped your call, and you were calling me back.
Okay, we're good. So again, you're making a lot of sense, Charlie. Okay, and I want to, be able to help, and if help is just telling your mom to stay away, I'm good with that.
No, I mean, Mark, it's not. That's weird. That's what's difficult to even understand, how you can come to that conclusion right after you stated, well, obviously, I want to get you help to get your medical thing going on. So staying away is not really the issue. It's it's having, very basically, if you're going to take me out of it, then it's is having an understanding about the mental health status of the patient who contacted you, whether it be me or her. But the thing is, she's in Florida and she's the one who contacted you, so it seems more appropriate for you to be able to explore, or at least explain to her what's going on, because one of the main issues is, again, there's a back and forth going on where my mother will say, I fully understand what's going on. Again, the exact same words that came out of your mouth have come out of my mother's mouth many times as far as my medical situation. In other words, understanding that it makes no sense for doctors to be saying that they're listening to my mother more than they're listening to me. Yet, in written, these are actual documented things. My mother wrote a letter to the hospital. In the letter, you can see that it seems as if she has no understanding of what she's writing. In other words, she's not writing the hospital and saying, hey, you have this medical record that says I said these things and I didn't say these things. Instead, what she wrote to the hospital was, hey, Charlie said these things and I think that you're using them against him. Very different approach. Very, very different approach.
Right. Okay. So given that reality, what do you think could be done with me intervening with your mom? What do I need to tell her maybe to get her on a better path?
Well, for me, I mean, again, to me, this is not about telling her, I guess. It's more about help. That's where it comes down to this totally different thing. Like, again, I don't want to keep going down through these tangents, Mark, but one of the whole reasons I even got her to get to actually speak to somebody in Florida was because about a month ago, I randomly, because it seems from what you stated, my mother stated to you that she believes we're not communicating well, and that she would like to have some kind of relationship with her granddaughter and things like this. And yet,
correct. That's correct. That's all correct. Yeah.
So in order to kind of just test that, because at the same time, my mother has also, again, has said the exact opposite. She has said that she wants nothing to do with me, that I don't want to see my daughter, and that's why she doesn't want me in her life, and all these kind of things. I randomly asked her for $500 a month ago. The reason why I asked her for $500 was to try to get to a therapist, because like I said, it's been this whole kind of circle of therapists in which either I will contact a therapist, and then they speak to her, and then somehow or another we can't go any further, or she will contact a therapist here in San Francisco, and the therapist will say, hey, it's really better for you to find somebody in Florida. In other words, we go nowhere, right? So the whole reason I asked her for the money was to be able to pay for a therapist. So in this particular situation where I'm at is, I can pay you, I can pay you and my mother can pay you. We're both in the same position. I think what's lacking is that we're also both in the same position in which you seem to believe that we are able to give you the steps to do in order to solve the matters, and if we could, there would be no need for a therapist. In other words, the fact alone that you're asking me what would be the thing would be the reason why she called you. So I don't know. I don't know what the proper. I've never been in this situation before. It seems ridiculous to me that you, my mother, and myself all can understand a very basic medical practice or policy or ethics, that you could understand that a medical record shouldn't be based on the words of somebody else, and yet that's what I'm living with. And that is inhibiting my ability to be able to kind of just talk to my doctors, because I don't understand. That's where it comes down to. I understand it may not be appropriate since you're in Florida, but as a mental health question, it does seem appropriate since I have you on the phone. I really don't understand how I'm supposed to trust the same doctor who's to give me thoughts about my heart failure, who thinks it's perfectly fine to refer to a medical record that they themselves know is incorrect.
No. Yeah, I'm not trying to do that. I'm not trying to get.
So just to make it more summary, then what I'm saying is I don't know the steps to solve it.
What's that?
I'm saying just to kind of make it very more clear is that I don't know the exact steps to solve it. If I'm gonna guess, it could be as effective for you to be able to contact my doctors and say, hey, I've talked to Jerry, my mother, and she I don't know, I guess I can't predict the future, but I've talked to her, I've talked to Charlie, and this is inhibiting his ability to get medical care. Let's at least solve the situation of what his mother has said shouldn't be referred to. I don't know the proper way to do that. It does seem like that would be effective. Another effective way would just for me even to at least for once.
Okay, good. So I'm on board to do that if you want me to do that.
I don't want to exaggerate, Mark.
I feel like there has to be a degree of trust first, and you're going to have to see, but you'll be able to see right away. If I speak to one of your cardiologists and I say that from a clinical psychology standpoint, they need to trust and put weight on everything you are saying and really minimize anything in the record that's coming from Jerry.
It's only one thing.
I find... What's that?
I don't want you to be confused, Mark. Like, it is only... What makes it very odd is that it is only one thing. So I understand the way you were speaking, but I also don't want to make it seem as if there's multiple things or anything like that. It's only one thing. I don't understand why it's there. But yeah, without going further on that.
Okay. So I'm not positive. What does that mean? I'm not following that.
Oh, no, the way you were saying it made it seem as if there were multiple kind of interactions where my mother has had with me as an adult with my medical doctors, and that's not true. In fact, that's exactly why there's a question about this one, because it doesn't make any sense. And so I just wanted to clarify that.
Okay.
So I don't know how to proceed, Mark. I do. One of the things that's kind of happening, and that's exactly what I don't want to do. Like, I really do I've had chest pains for a couple days now, and stress is a problem for me, and I don't want to continue down this path. Because it does start getting upsetting, because I'm worried about my mother. Like without going too much back and forth on it, obviously she seems to be competent, but I also have a lifetime of information that would justify beliefs in her mental health, concerns about her mental health, and so those are two different ways of looking at it, and one is a lot more concerning than the other, for me at least.
Okay. Let me ask you a more difficult question then. Given the fact that she's done harm to your daughter, is it possible that harm is because she's just in denial about things?
I would say if I was gonna summarize it
very well, but that she's well intentioned, or
no,
is that not the case?
Yes, well intentioned. In other words, if I was gonna summarize it, I would say it is pretty much, I guess, what she's done with me as well. As far as my mother's fairly. If I came across this the other day, and thinking about it, and it does summarize it as weird as it sounds. My mother's pretty much a narcissist who believes money will solve everything. And so as far as when it comes to my daughter and me, what it comes down to is she's helping the best way she possibly can, and this is a situation in which money, we've had this discussion in the past. But what I don't want to pass is everything that my mother has done, my mother described to me. At the time that she did, I did not think that my mother was that crazy to fucking do this shit. But everything that she has done, she described to me as what she would do in the situation that I found myself in which it seemed as if I was dealing with an either corrupt or unethical kind of court situation, and because of the way the laws were or are here in California surrounding mental health diagnosis and the way I had approached mental health in the past, put me in a really, it is what it is. It put me in a situation in which unable to address the known concerns about the mother of my child's mental health issues with my daughter. So if I was going to summarize it in a way, kind of saying, I'm going to do, it's karma. I'm going to do what's basically happening to you.
Okay. Charlie?
Yes. Sorry, I don't know what else. I don't want to keep rambling, but that's kind of it.
Okay. So what is your relationship like with your daughter?
I don't have anymore. So when I say that she's inhibited it. And when I say like I'm going to do what they're going to what's happening to you is I'm going to do what the summary of that is the mother of my child is an only child, and I was with her for about 5 years. There's not really anybody else around, and so what my mother has basically done is done the opposite in the same way. So in other words, my mother has made me look like the way the mother of my child should look. In other words, without anybody really around or anybody who's there kind of being somewhat suspicious because they're kind of newer and not really family or anything like that.
Okay. How old is your daughter?
She's going to be 10.
She's 10, okay. I mean, if you tried to speak with her mother, would she accept that, or has she been...
No, the mother... No, again, she's doing very much the exact same thing. So the mother of my child, like, the only way I could summarize it, she was... I had to... I just don't want to get too tangenting on it, but basically, after our child was born, there were really big differences as far as her behaviors and actions and everything. We went to couples therapy. From that, it was suggested that she see a psychologist. She was then put on meds. She had a suicide attempt. We went back to that therapist. The therapist then diagnosed us with dissociative identity disorder. Dissociative identity disorder. Without kind of skipping that part, because my mother has kind of tried this as well, or kind of addressed this in her actions as well. That suicide attempt, the problem with the way I approached it is, she did it. I didn't want to call the cops, so we just made an appointment with her therapist, and we went back to the therapist. So in other words, instead of treating it as an emergency situation, it wasn't treated as an emergency situation. And from that appointment was when she was diagnosed, but she never wanted to do any therapy. Things got worse as far as kind of just her abusive behavior. We separated about 4 or 5 months after her diagnosis. And then from then on, she has pretty much kind of fluctuated back and forth as to whether or not she's ever even received a diagnosis, as well as there's never been any real discussion as to the consequences or the consequences of that diagnosis. With her being a parent.
Okay.
So I'm sorry. I hope I didn't go on any tangents. Do you understand what I meant by that?
So is there any way? Do you feel like? Are you worried about your daughter? Let me ask you that.
Oh, extremely so. So I guess what I didn't wrap that up in is, so I basically just found myself in a situation in which exactly what's happening with my mother is what was happening with the mother of my child. I had majority custody of our daughter after our separation. So I was the majority person with my daughter, dealing with somebody who was like my mother. In other words, somebody who was saying to other people and acting as if they're talking to me, but I wasn't actually talking to them. They never actually talked to me. So in summary of that is, for about that went on for about 3 to 4 years, until I got to the point where I said to the judge, I was like, there was evidence that my daughter was being abused, and the court didn't want to speak about that. They didn't want to speak about the mother's mental health. They didn't want to speak about anything, and so I said to the court, I don't feel comfortable with this. Like, like my daughter's coming to me abused. She's only with her mother for a couple days, and then she comes to me with scars and all this other fucking shit. Not really scars, but wounds. And nobody's talking about it. So I basically said I don't want to see my daughter until we get some answers on this, and that's it. So with my mother should fully understand that. That's not a complicated thing to understand. But my mother, as far as I know, even from the way she contacted you, seems to believe that I just don't want to see my daughter. Like, as far as I can tell, my mother has difficulty understanding that I had majority custody of my daughter. At times she seems to act as if I only had my daughter on weekends, which is not true at all. Other times she seems to understand fully that I had full custody of my daughter, but then seems to believe that I just randomly decided that I didn't want to be a father anymore. She's not able to have any conversations with me about it the way I'm able to speak to you about it, of this is exactly what happened.
Okay. Do you think that your mom could provide some help to your daughter, given the history, or no?
Again, so the only way I can put it to you, Mark, is that my mother has never been around a child, and I mean that very literally. Even it's weird because I'm her child, but that's still a fact. So in other words, I've never seen my mother alone with any child under the age of maybe 13, 14 years old, and that's if that. So when you ask me whether or not my mother could be helpful, my mother could be helpful the exact same way she's been helpful to me, and it is one of those things. My mother, again, is a narcissist who believes money can solve everything. Because in a certain sense I wasn't raised by my mother, at least for the beginning part of my life, I'm actually somewhat the opposite as her, in which I don't believe money solves everything. But I have learned that it does solve a lot of things. So if I had to answer the question as to whether or not my mother could be helpful to me or my daughter, the fact of the matter is, more than likely, as long as she maintains the attitude of money solves everything, more than likely she could be. As far as the things she's done, as horrible as they are, I also know that me and my mother discussed these things, and so whether or not it's either mental health or she's doing them all on purpose, the fact is it still was the smarter thing to do. Again, even if it's mental health, the fact of the matter is, when it comes down to it, in high school, I told my mother I believe she was bipolar, and she seemed to have accepted it up to a certain point back then. The thing is, I moved away from her as soon as I possibly could, and so I never really dealt with it much, and maybe she didn't either. But the fact is, if I'm going to be honest with it, it seems as if my mother also has been aware of the fact that she has had mental health issues for a long time, because of the fact that, it's only basically me and my stepfather who have any real interactions with her in any way that are different than anybody else, that she would have to deal with it. So it also makes sense for many reasons that she would act this way, whether even if there's a tinge of mental health as well, because it just goes better. I don't know how to, without kind of exposing everything that, all about my mother's life, it's timed as she would have wanted it, not as I would have wanted it, but as she would have.
Are you in contact with your stepfather?
No, my stepfather has done the same thing, except that he's one of the reasons why I think it is more of a plan up to certain points, because my stepfather believes that I took him to court. That's the last conversation I had with him. The last conversation I had was when I got, or not even a conversation, the last text message I sent to him was when I got out of the hospital. At the time, I did not know that the false medical record or the medical record, including incorrect information, existed, so I did not know that at the time. But I did know that there was issues communicating with my mother, and obviously with the heart failure. So I communicated with my dad, and I was just kind of basically this has gone too fucking far. I don't know what's going on, and I have heart failure now. This can't go on. And my dad replied to me that I took him to court, something that never happened. And at that point, because of the fact that I don't have reasons to believe that my dad has mental health issues, but I do have reasons to believe that my mother has had them for quite a while. I haven't gone down that road. Also, with the added additional thing of my mother has stated all these things before my dad hasn't. So it's kind of just I don't even know how to approach it.
Okay. Is there anyone in touch with your daughter's mom that could be a
No.
reasonable...
So when I said again, I'll repeat it again. The mother of my child...
What's that?
I'll repeat it again.
Yes.
The mother of my child is an only child who has no other family members in it. In other words, as the 5 years I was with her, the only other family members that I met or heard of was her mother, and then she has one distant cousin who lives also here in San Francisco. And when I say distant, what I mean is that it is her mother's cousin, so that makes her second cousin. And those were the only two people in the entire 5 years that we were together that I had ever heard of. Not even no friends, no family members, nothing like that. So there is no one in contact with the mother of my child. There was no one in contact with the mother of my child when I was in a relationship with her, and I don't know how. It's very similar. I guess I didn't make that point earlier. It's extremely similar to the situation of my mother, which is the mother of my child. I don't know how to approach talking to her. One, because she actually has been diagnosed with a mental health disorder, and two, is the exact same situation similarly with my mother, where, with the medical record, where it's kind of like my mother, everybody seems to kind of be able to understand something's inappropriate, but yet when they speak to me alone, they revert to believing or acting as if that thing that they stated they understood was inappropriate was appropriate. Sorry, I don't know if the siren...
I can hear it, but it's okay.
Okay. So I to summarize it again, the same thing with, my mother and the mother of my child, of them stating to me an understanding of something that was inappropriate, and then when we speak alone, being unable to recall or acknowledge a action that has happened was inappropriate.
Okay. Okay, I'm not going to switch gears and change. I get what you're saying. I'm just trying to think how I can be... Maybe the focus should be on me working with your mom on her underlying bipolar disorder, which she's never...
I don't know. I do know that that's more of a conversation that I feel is appropriate. And again, this is where I am lost on it, because I don't have my stepfather to speak about this. And unfortunately, the other members of my family, have various levels of both education and proficiency in English. And so it makes it much more difficult to have, a productive conversation about these things with. But I don't know what's the appropriate way to approach it with my mother. Like I said, this is not something, as far as concerns about her mental health, that's not something that's new, nor is it something that I am the only person who has stated those concerns. And so approaching that particular thing of it is something I am completely lost on, because I don't know what's the best way, and I don't know what's appropriate. But sorry, but not to kind of focus on what actually matters is, I really do. There's two things going on. One thing that I did kind of let go, or not put to the forefront, because one would be solved by the other, is, I do need kind of refills of medication as well. So I have a certain amount of time. I have about a week or so, and I've been trying to deal with this as it is. My mother so also clarifying that, my mother's side kind of what do you put that? Surprised me with this. In other words, I've been asking her for this for the longest time. Like I said, I asked her for the $500 a month ago, and I've been bringing this up pretty much ever since. And I have been trying to contact therapists on my own. It just hasn't worked out. So the focus definitely should be one on I really do want to be able to speak to my doctors, but I can't. it seems logical that I can't really speak to them with and have trust in what they're saying, with knowing that they're referring to an incorrect medical record. It just seems, even though it's not necessarily entirely relevant to my heart failure, it is relevant to their practice, if you can understand what I'm saying.
Okay. Yes. But they don't have to necessarily take what she's saying. I mean, to me, that should be like very secondary information, not primary information.
That's what I'm saying, and but yet that's what's happened. Again, I don't want to keep kind of going down on it, but like, as far as what I meant by restating that was just simply that is something that I would like. It's not even a like. I need to solve. This is just surprising me in the sense of this is another avenue. But I've already kind of gone down the other ways. Like one of the ways the doctors have been going around this is they keep if I go to Walgreens and request a refill, they'll kind of do the back end of getting me my medicine, which is fine. But we're still not talking about the fucking elephant in the room, which is this my mother, basically.
Okay, so that's my focus, is on dealing with the elephant in the room, which is your mother. I get that.
No. The elephant in the room is the fact that I have heart failure. Sorry, Mark. I don't.
You in that process.
Sorry, Mark. I didn't hear what you said. Could you repeat yourself?
I get that the elephant in the room is your mother, and that's where my focus needs to be.
No. Sorry, I didn't mean to cut you off, Mark. But what I want to clarify, the elephant in the room is not my mother. The elephant in the room is that I have heart failure, and nobody's taking it seriously, including my mother. But my mother is the least important of the people that need to take that seriously, and she understands that as well.
Okay. So, I mean, is there something I can do to help with that? Which I could say to her, look, this is a reality. This is not manufactured in your head. You need help with this, and then get her to do something if you would like me to try to do that.
Yeah, I guess the only thing that has me lost on it is, and that's understandable. So I'm not saying it's not understandable, but is having any idea from you as to what would be the secondary. In other words, one of the things that kind of is frustrating for me and has been is I already understand that my mother she's doing something, whether again it be for mental health issues or it be on purpose. What she is doing is she is trying to block any progression, or at the very least has been, and this is actually a very big step opposite, which to me, as her son and as somebody who's been dealing with her for a long time, says that she's ready to do something different, which is also what you're indicating, except you're indicating it not having any knowledge or real acknowledgement, it seems to me at the very least, of understanding that her past actions have been to ensure to block something, and so to approach it as I can just kind of talk to her and that's going to solve everything seems a little bit delusional in the sense of not acknowledging the facts are that has not been the case, while I am still acknowledging the fact that by reaching out to you, she's obviously also signaling that she would like to do something different this time.
I think that she doesn't want to acknowledge that she may have issues. I mean, she says in theory she does. She accepts that she wasn't involved in your childhood. She has excuses for that. But I'm fine with the model that says she can't be directly facing the bipolar condition because it's too painful, so it's got to be a warming up process. But if she's getting in the way of things for you, and there's a way for me to intervene to help with that, I'd like to do that.
Yeah, that's what I'm asking you to do. Just I don't know. I can't dictate it, Mark. Like, that's what I'm saying. Like, this is what's very odd about it, and that's what again. This is one of those situations in which, you know, my mom has outsmarted me on this one because I don't know what to do with this in the sense of I know that she knows that you do there are standard ways to handle these things. I don't know what they are though. My mother has, again, just more info. My dad has worked in the medical field for 30 years. The way my mother and my father met was in the hospital. My mother used to be an OBGYN, like assistant or whatever. So my mother is very well versed on how these things work. One of the things also that happened was when my mother met my father, she was married to another person at the time. That person attempted suicide and was her dependent in the Air Force, and because of that, there were certain ways that went down. I never really paid much attention to it, but I do know that my mother is also aware of these things. So that's what makes it difficult, because I am in a position in which I am ignorant. Like I don't know, but I know enough to know that my mother knows that you shouldn't be approaching this situation the way you are with me. In other words, saying to me, I would like to help, as if you don't know how, or it's not expected, or in certain places by law you would know what you have to do. In other words, it's extremely inappropriate to be coming to me for it. It's like the bipolar thing, and it's the exact same way. And again, I don't know if this is inappropriate, but if I talk to my mother about the bipolar thing the same way I talk to the mother of my child about it, it's about, hey, this is what I observed, this is what I think. It's all on you. I have nothing. I can't say anything. Like I don't know. I haven't lived with my mother. The facts are, I lived with my mother for about 8 years. That's it. I don't know my mother that well enough to be able to say. I can only go by the fact that she is my mother. I have other family members, and yeah, she's been part of my life forever. As long as my life is. But I can't say whether or not I know whether or not my mother's bipolar, because when I came to those conclusions, I was a teenager. I didn't have it's not like I had a whole bunch of information on bipolar. I think I just looked it up one time, or I asked somebody about it, and they told me these were the symptoms, and I was like, my mother's kind of like that, and I tried to talk to her about it. I don't think it's appropriate to say that she has bipolar, or other than saying that I think, in my observations, it's a reasonable either addition or cause for her actions.
Okay. I mean, well, let me ask you this. I mean, again, if your mother is my patient, you are simply collateral support. And I do evaluations a lot where collaterals, you can't rely on somebody who doesn't have self-awareness to tell you what's going on. You need outside collaterals to capture what they are unable to see about themselves. If you are seeing, based on your 8 years of living with your mom, the contact that you've had with her, the way in which she's tried to sabotage your relationship with your daughter, the way in which she operates with you, if you've seen signs of her having a bipolar disorder, that helps me to have a model for treating her. And she's the patient. You are a collateral support providing outside information as to what may be going on with her.
No, I understand, but I want to make it clear that my father would be the more appropriate person. Like, he lives with her. Like, and he's in a relationship with her. Like, that's a much more...
He's blind. He is blind.
Well, I would say I can't argue too much on that.
Okay. Because that's what the case is. I think that you have, even though it's past, not current, and even though it's more limited, I think you have a more accurate view.
Yeah, and that's where, again, I don't know what the appropriate way to put it. And this is getting difficult for me, but because it is current in the sense of it's current. Like, my mother just contacted you. It's not as if we're having no contact. Like I said, a month ago, as odd as it sounds, I literally randomly said to my mother, just send me $500 and I'm going to try to figure shit out. Didn't say why, didn't say how, didn't say anything, and she sent it to me, questions unasked. That's absolutely ridiculous. Like, when she sent it, almost immediately, if it wasn't for the fact that it hasn't worked out well in the past, I wanted to call the police or somebody and say, this is ridiculous. My mother, they should have it on record. My mother has said to you that she believes, I think at one time she said I was a drug addict. My mother has said to you that I'm a drug addict and that the only reason I would be calling a wellness check on her is so that she could send me money for drugs. And yet, she just sent me $500. Like, that's the reality I'm living in. Now, I think it's difficult to understand because of the fact that I've learned to cope with these things in the sense of I should be able to just call my father and be like, what the fuck is going on? To me, that seems like the most illogical thing. But I'm not able to.
I just lost you there again.
Sorry. Well, I do feel as if, because I'm seeing right now, it looks like we've been talking for a while. I personally would very much appreciate being able to focus on my mother understanding that I do need to speak to my doctors about my heart failure, and that she is inhibiting that. Many other things would be solved from that, but very realistically, whether it be medical, mental health, no matter what checklist you put of triage, the fact is both I and my mother should be able to understand that the priority should be my heart failure and having, quality care around that, and everything else would kind of flow. So I want to focus on that. The only thing I do want to kind of mention, because this is a thing that maybe you could talk to my mother about, again, she doesn't seem to understand that I have heart failure, but she offered to buy me a mattress the other day. And again, these are one of these strange things, just for collateral, I guess. One of the reason why that's an important kind of understanding of where a mattress is. My mother and her father, my grandfather, they weren't together. My grandmother separated from him when they were younger. The only thing that my grandmother got from her father, my mother's father, was $100 in a mattress. That's the only thing he ever gave her. And my grandmother has always, not always, I know that story. The kind of weird thing about that is my mother, and the reason it's relevant is because of the way my mother's acted with the mother of my child. My mother is the only one who has stayed in contact with her father's side of the family, and so it is kind of a big deal. And the mattress that I sleep on is the mattress that belonged to a member of that family, without getting too much further into it. So it is extremely odd, not just because of the fact that my mother doesn't seem to be able to understand that I have heart failure. There are other kind of things involved in which that need to be addressed. But she also randomly the other day decided that she wants to buy me a mattress, and that is coinciding with contacting a therapist in Florida. So in other words, there are two real kind of signals that my mother is seemingly acting very different than she has in the past as far as her approach to therapy.
Okay. So if again, since she's the patient and I'm focusing on getting her help, I at least need to be tuned into not having her do more harm to you.
Yeah, and
is it best? What's that?
Sorry, that would be immediately kind of focusing on my medical health, and understanding that right now the doctors are referring to a medical record with her information, and it's not as if she hasn't tried in the past. Again, I guess this is where it becomes difficult. She wrote them a letter. The thing is, she wrote them a letter, and the letter seems to indicate that I am just simply unhappy with what was said versus why are you listening to me? Those are two different things. You kind of get what I'm saying? So in other words, my mother wrote a letter to the hospital saying, hey, Charlie has his medical record that says, it's based on information I gave, and I'm writing, my mother's writing the hospital because she believes that I just don't like what it says, instead of writing the hospital and saying, I have no idea why you're referring to me.
Okay. So if she writes a correction to that letter, would that be helpful?
Well, obviously, yes. But again, what would be more helpful, both to me and her, is having some sort of understanding. And I guess this is where it becomes difficult. I don't know what to say to you more. Like, for my mother, again, my mother described all this, including acting crazy, all this. She described to me when I first separated with the mother of my child after the first court hearing. She described that she was going to do all this. I thought all that was crazy. None of it makes sense. Just as if it would not make sense for my mother to get on a plane and fly to California and show up at her granddaughter's house completely unannounced and get a restraining order issued against her instead of, scheduling something with the court for visitation. So it's all the same in the sense of she's either acting or being really crazy, and that's what needs to be solved, is whether or not my mother has any understanding of actual basic things. Like right now, where it becomes difficult for me to understand what to do is that has nothing to do with opinions, or to me it just seems like a much more intense situation for my mother not to have an understanding that she has contributed to delay and or obstruction of my medical care.
Okay, why do you think that those two are so separate?
Well, because I think I must have misspoke. What I mean by, if I meant by separate, what I mean is my medical. There's not an opinion on whether or not my mother wrote the hospital. And
right,
the tone,
totally with you on that.
and the tone and intention of that letter. In other words, I guess I could put it a different way. So I've had one job that was somewhat similar to my mother as far as being an auditor. I worked for Charles Schwab for a little bit, and I used to communicate with the IRS, right? And the way to communicate with the IRS is basically you kind of have to write out mathematical word problems. In other words, you write out a mathematical word problem in the written word, and it can't have any kind of errors or associations to things that are different, because it's basically math and words, right? And so in this particular situation, the main part of the equation is whether or not she has an understanding of a legal document. So in other words, there is a medical record separate of the other one that we're speaking of. There is a medical record that states I have congestive heart failure. On top of that, there is the fact that my mother, at the time, to collateral on this as well, my mother supposedly flew, I've never gotten a clarification on this, my mother supposedly flew out to San Francisco while I was in the hospital. I refused to see my mother at the time because of these mental health things. Basically the same thing. Like, you need to talk to a therapist before you talk to me. Like, I'm in the hospital with heart failure, and you're not able to have a conversation about some really serious things. I'm not going to put myself through that. So, that along with the letter, those are two separate things that say that my mother should have no problem understanding, along with her job, no problem understanding that I have heart failure, and that she is inhibiting my ability to have proper care. None. So I don't know, to me, that's where it becomes this weird thing. And again, it is tied with the mother of my child as well, where it's like, I don't know what to do. I've only experienced these situations with my mother and the mother of my child in which this is a blatant need for mental health care, and yet people are responding as if it's going to be okay, like it's all right. I have never experienced that in my life, and I guess the thing is as well is that it seems as if the approach is, well, you know how that goes. You've written doctors in the past and then been like, no, I never did.
Okay. So, my goal is to see if I can make your mom less delusional and to work on her mental health. And then maybe if she gets more grounded, then there's the possibility of her being able to have a little bit better relationship with you.
Well, again, I guess that's where the difference.
Go ahead.
That's sorry, Mark, but this is where it becomes, again, this is one of those things where I don't understand where we're going with this. Like, you're going on a maybe. Now, again, from my understanding, there are no maybes. This is what I've heard out of my mother's mouth, period. In Florida, there shouldn't be any maybes because of the Baker Act. Again, one of those things that oh my God, I don't want to keep going around on it, but in California they're thinking of implementing these things. It's in the news currently, but in Florida there isn't a maybe. So as far as I know, in Florida there isn't a maybe as far as the way she's acting. There aren't maybes. There should be an actual evaluation from that, no matter what. Period. So that's where it becomes difficult because I understand that here in California, I've lived through it. In California, apparently it's a maybe. Apparently, you could be losing your entire fucking mind, and it's always a maybe. It's like, well, maybe it'll get better, maybe not. There's nothing that can be done. And without getting into it, because there are various schools on thought of whether or not that's appropriate, the facts are that from my understanding and my mother's understanding, which is more important as far as like understanding the situation as far as what she has said to me, is that she doesn't believe there's a maybe in this situation. She, as far as I understand, she didn't speak to you or reach out to somebody in Florida, whoever's in Florida, because she believed that there was a maybe in the situation. She believed that there would be an actual action that would come out of it, and the action would be an evaluation, a forced evaluation at that particular point, which would be forced because of the fact that she was basically asking for it and then said I didn't need it, which to me does make somewhat logical sense as to why a forced evaluation would happen in Florida at that particular point, but also why it doesn't happen in California is the thought being that you should always be able to say whether or not you want an evaluation.
Correct. So, but right now, I feel like you're helping me to have a better take. It's an informal, not a formal evaluation of your mom, but you're helping me to better understand what's going on for her, and I think that's a helpful piece in this process. Yeah,
Mark, I'm sorry, I am getting kind of, I just, like, the thing is, I don't want to go round and round on it, and I am, sorry, it just starts getting, for me, it's a little emotional.
Okay.
The fact of the matter is, like, this is a little new for me as far as the physical things that I'm dealing with over the last couple of days, and it was already concerning for me, and then this is kind of getting thrown a different way, and, you know, it's upsetting me a little bit because I need to kind of figure out what the fuck's going on with my heart. So I kind of want to wrap this up, and I understand that you're gonna approach somehow speaking to my mother about the fact that I need to kind of solve this situation with my doctors as far as the medical record that refers to information that she has given, as well as her follow-up to try to correct that information, or I guess just not understanding the consequences of her actions and how they relate to my ability to deal with my medical situation. So I particularly feel as if I have an understanding of that. I have an understanding that you have an understanding that my medical care would be a priority that would end up also addressing and properly approaching my mother's mental health situation. Is that correct?
Okay, I mean, just me, I also want to be absolutely clear that she does have a mental health issue. You are providing me with information to get her into better treatment. But the number one priority is for her not to be interfering with the medical care that you're getting for your heart condition.
Exactly, and currently that is happening.
Okay. Right. So if I can if I can do a follow-up call with you, and if there's a way that she can write something and you can dictate to me what she needs to write.
Yeah, that's where, Mark, that's where it becomes very inappropriate.
It's possible she'll resist, and I won't be able to get very far, but if I can get her on board to sign something that makes it so that you can get better, cardiologist.
Yes, I agree. I will not
for your
argue.
health. I'm on board to do that.
I agree. I do want to make it clear with you, Mark, is that I am not. This is what is very odd about me, especially when it comes to if you deal with my mother and then deal with me. I don't like to dictate things. I don't. I don't know if it's a product of being her son or not. All I know is that I don't find it appropriate to try to dictate people's lives or things. It is what it is. And so I understand that it is not meant necessarily in a ill-intentioned form, but when you use words like dictate or tell me or I want you to tell me what to do, it does trigger something in me because I have a daughter. My daughter is the only person in the world who that's appropriate with. And so that's just kind of the way I see it.
Okay, so think of it this way. I mean, what I am interested in doing, though, is possibly getting your mom better help. At the same time, if you could just guide me, don't dictate, you don't have to tell me, guide me. If there's something I need to get her to do.
Yeah, I understand, Mark. I would have to think about it because I've never been in this position before. But I do understand that it is possible that a written letter that is actually signed by my mother and understood, by you and her to kind of hopefully address the situation with my medical care would solve the problem. I just don't know exactly how to word it because I just don't know exactly how to word it. So that's just kind of something I need to think about.
Okay.
And just kind of approach.
I like that idea. You'll think about it, and I can do a follow-up call.
Yes, if you could just,
and in the meantime, I'll focus on trying to get help for your mom.
Yes, if you could please speak to my mother and see, I guess, have some sort of understand. I guess what it comes down to, and I guess this is because the odd thing about this is that that's what my mother asked me to do when she wrote the letter, and again, I refused to dictate it, but that was for two different reasons, not the same for you. One is just that's how I am. With her was because it was also trying to kind of figure out, like, I shouldn't have to tell you you're my mother. Like, she works as an auditor. Like, I shouldn't have to tell you. And so I guess that's why it put to me, I react the way I'm reacting right now because I have been here before in a certain sense, and I didn't think of a way to write it because in both situations it seems as if it would be more appropriate if it was written in somebody else's words, not mine. However, I understand that it may be appropriate for me to do that. I will do that. If you could please just also, before I do that, I guess is what I need to clarify, I would like to have some sort of understanding as to what my mother's state of mind is, because obviously if I'm asking her to sign something that's written for her, if it's something that she can disagree with, then we're not really getting anywhere. And it seems as if the goal would be to have an understanding of what it is she agrees to.
Okay. That makes sense. Okay, so you take the time to think about it. We will speak again.
Okay.
In the meantime,
do you think like within a day, or okay. Do you think like a day or two?
What's that?
Do you believe like in a day or two? Because again, Mark, this is where I got to kind of switch gears. Is
that's fine.
I'm dealing
call you back in a day or two.
Yes, you said yes.
Yes, I can call you back in a day or two.
Okay, good. Just because, like I said, I'm dealing with. I had already started in my other things to try to solve this as well, and so I just want to be clear. I just need to kind of, I need to be a little bit, like I can already feel my stress level going down a little bit. I just need to be a little bit more clear as to what is even potential to happen. So that's good. So I want to thank you, Mark. And I'm not trying to dictate things, but I want to say thank you. Obviously, like I said, if there's any issues of payments and things like that, because one of the things my mother has, like I said, she likes to believe, or many people also have this thought of, she's the one paying, and so she's the one who can dictate everything. But I do understand that you spent some time speaking to me. Like I said, my mother has provided me with funds specifically for this. So if that's needed, definitely let me know, so that doesn't become an issue.
Okay. Thank you for that. I'm going to burden her because my goal in speaking to you was to have a better understanding of what was going on for her, and you really filled that in.
Well, that was actually my goal, because the thing is, as well, is again, my mother just told me she made an appointment with you, but not at all about anything that's going on, and so I was completely blind as to why she had contacted you.
Okay, so now you know.
Now I know.
Now you understand that she's the patient. You are, collateral support, so I can do a better job of helping her with her blind spots.
Yes,
you've also been really clear about the main issue for you is, the heart disease issue, and that if there is something that could be helpful that she needs to write and sign, I'm behind doing that, because I want her to see that she needs to accept certain things about what's going on and not be in denial.
Yeah, I mean, that's where I'm lost on it, because it does seem like that's logical. That's what should happen. Sorry, I don't want to keep going down. So yes, I understand everything you said, Mark. I believe I did at the very least. I should hear from you within a day or two, and from there we can kind of hopefully at least be able to solve the situation, so I can at least reach out to my doctors. Even if she can't, at least I would have something signed from her that we can at least proceed and actually have a conversation about my state of my state of health right now.
Yes, that's a good summary.
Cool. Thank you.
Agree, Charlie.
All right, thank you, Mark.
Okay.
I very much look forward to hearing from you.
I look forward to talking to you. Yes. Okay. Bye-bye.
Thank you. Bye.
All right. So the thing about that is, he never called back. There should be a link in the description to another video where I called the Tampa PD to try to see if they could get me some help with this. That's an interesting listen to as well. In hindsight, as always, obviously, I did not need to speak that long. This should have been maybe a 5-minute phone call. Don't know why it took this long as it is. But yeah, that's Dr. Mark Prange of Tampa, Florida, who was called by my mother to try to communicate with me so that we can communicate together. You should be able to hear everything that's going on. There is a recent text from my mother in December in which she is asking me to contact Dr. Prange. There it is right there. And you can see that she says, Dr. Prange is willing to speak to whoever you go to get assistance, and I can use him as a reference. Seemingly, I don't know, as a reference to what. In that phone call, you can hear that Dr. Prange is saying that my mother is the patient. I don't know what I would use him as a reference to. It's all fucking weird. Anyway, that's that phone call.